That's what we're talking about today. They face more than medical decisions. They face fear, identity, intimacy changes, emotional battles that most never talk about. Every man has a story, every diagnosis has a journey, and every journey carries emotions that medicine alone can't heal. Today, we sit down with someone who understands that deeply, a licensed independent clinical social worker who has walked alongside men fighting prostate cancer. I'm sure he's seen the tears that we don't always admit to, the fears we don't always acknowledge, but the resilience that arises when men have to have the space to talk, to feel, and to be seen. And that space is here, and that space is now.
So we have a confirmation with a second opinion that he definitely has prostate cancer.
I'm Reggie Hicks. Welcome back, producer of the documentary and outreach project, If You Are My Brothers, and host of this podcast, the If You Are My Brothers podcast, Prostate Cancer Conversations. I was going to do that. Welcome to everyone watching on YouTube, LinkedIn, Facebook Live, and to those listening on your favorite podcast platforms. We will be bringing out our two guests in just a few minutes to talk about the psychology of prostate cancer. But first, as always, a quick reminder this podcast is not a substitute for your medical team. The opinions and medical issues we discuss are not a replacement for treatment. Always consult your healthcare provider. And remember, some conversations on this podcast are of an adult nature. So please, we ask that you listen accordingly. Excuse me. Now, we call this series podcast cancer, prostate cancer conversations. Here we go again. And we invite you to join us in the chat with your questions and comments. Don't be shy. This is real time. And remember to like, share, and subscribe as we go on this journey together. Now, to learn more about this podcast and the If You Are My Brothers documentary and community engagement project, you can visit us at ifyouaremybrothers.org. Now, we've got two very special guests. First of all, a person that's not been on the show before is Max McMahon. And Max is a Boston based clinical social worker and cancer survivor himself with 4 years of experience in GU oncology at Dana-Farber Cancer Institute in Boston. Max has provided counseling for men with prostate cancer, focusing on sexual health, male identity, intimacy, aging, and coping with serious illness. He also assisted the oncology team with complex issues related to care, navigation, and treatment decisions. Now, currently, he serves as a clinical trial therapist for psychedelic research trials, and I'm hoping we'll be able to talk a little bit about that at the end, as well as he's a facilitator for the Real Recovery. It's a nonprofit that offers free fly fishing trips for men with cancer. I'm going to talk to him about that as well. Now, we're also joined by my friend and fraternity brother and frequent uh, guest, I guess, on the podcast, Eric Cheney. And I asked Eric to join us today because Eric and I have been communicating over the last, over a year or so, just about his journey. And for a while, Eric was doing active surveillance, or what I call back in the day watchful waiting. And Eric has an update for us today. But I thought it'd be good to bring you in, Eric, to talk to Max as well, because I know we had a lot of discussions really around your feelings. What do you do? How do you talk to your family, and that whole gamut of things, emotions that happen when we have this prostate cancer diagnosis. So welcome, Max, and welcome, Eric. Glad you could join us this evening.
Thank you, Reggie.
Thank you,
So
Reggie.
I want to start with you, Max. I've watched some of your webinars, and just thank you so much for the work that you do. And when you first began working with men facing these issues, particularly prostate cancer, what surprised you most about their kind of psychological needs?
Mm. What? What?
I know it's a loaded first question, right?
No, it's a wonderful question, Reggie. I think that a prostate cancer diagnosis, as you know, it's a shock. It's a confrontation with many things in life, and I think what struck me, what has struck me in the work is the fluency of men wanting to speak about their lives. Right? It's prostate cancer in some ways is the doorway. It kind of opens up this other portal into life, right? Into history, into relationships, into intimacy, into fears, into anxiety, into the unknown. And I think, I think men speaking with men is a very deeply personal space to be in. And for me, it's been a privilege because the conversations, just witnessing some of the conversations and being privy to them, um, I don't have the words for it, but it's been very humbling. And I always tell people the work that I've done, I don't do it from a perspective of feeling like an expert. I've always done it because, you know your story better than I know your story, and you can inform me about your story. And I always felt with, in working with men, that this sense of, I sort of collect and absorb these narratives from men. And what I hope to do is share what I've learned with others, because it's really incredible, sort of the themes and the depth that men will go to when they have that opportunity to really speak freely about their kind of interior worlds that they don't get to talk about that often. So yeah, it's a big question, and
we're just getting started.
We're just getting started. Yeah.
And Eric, when you found out you were going through this, what kind of went through your mind? I mean, we've talked, but just to kind of let the folk know that they're listening and watching, what was the first thing? Did you think about, like, shutting down, yelling, reaching out? Kind of what was your process when you knew what was happening?
I went through a myriad of emotions. First of all, immediately it was fear, concern about, where does this journey take me? What am I looking? What are some of the things I got to deal with? What are my options? And then I immediately started thinking about my family. How do I bring this out? Because see, you have to understand, and you and I've talked about this, that both my mother and father both died of cancer, and died at an early age in their lives. So it was, I never got a chance to even to become an adult. Both of my parents were gone from cancer. For each of them for various different reasons. One for not being diagnosed correctly, and one for not going out and getting treatment that she should have gotten it, and she had caught it at an earlier stage. She probably would have a much longer life. But the most important thing, I think, for me, I mean, after I got over the emotions sitting in the parking lot, after I come out of getting the MRI and getting those results, was that I needed to get information. So, and you were the first person that I thought about immediately. I gave you a call because I'm saying, I got these numbers, and I'm like, okay, what do they mean? That kind of thing. So, the emotional roller coaster that you're on, first thing you want to do is you want to go get up on the ledge and just jump off. This is it, And that's why I had to understand: is this where I am? And I tend to. This is just for me. I tend to look at things now at this particular point in my life as I look at whatever the worst case scenario is, and then I ask myself, okay, if I'm in the worst case scenario, what do I do and how do I deal with it? And if I'm able to figure out that I'm able to deal with the worst case scenario, anything else that's less than that is much more easier, a load for me to carry. So when I had the first conversation with you, you told me, she said, Eric, don't worry about this. This is where you are, kind of thing. That now you just don't know that first conversation you and I had just took a whole load off of me. And I understood, you know, where we were as far as, you know, it's a situation of I've got this. I'm ahead of the game. So let's start looking at those things and the options that I have in order so that I can make sure that my life is extended. I hope I answered your questions.
Yeah. I was going to go back to so Max can analyze. No, just kidding. we have your therapy session. That was my reason for getting you on here. No, I did have a question though, as this pertains to hope, because I remember watching something, Max. You mentioned you said reasonable hope, and I just wanted to kind of get your take on that, and in the context of this whole prostate cancer diagnosis thing. What is this reasonable hope you talked about?
Yeah, Reggie. Well, you know, I think reasonable hope is, can you hear me okay? I'm just the audio.
Yeah. Mm-hmm.
Okay.
Yeah.
You know, reasonable hope is asking yourself what's possible and what's possible and what's based on good information and what's based on what a medical team or an oncologist is offering me and telling me, right? And when you can have reasonable hope, then when you can hold on to something that keeps you imagining a future, that's profound, right? You need something to picture and envision. You know, reasonable means that there's a possibility that you'll attain it, or that it's something you can live for. The reason it's important is because if expectations are wildly off for one reason or another, then you know you're going to be disappointed. You know, if people are saying, "Oh, you're going to beat this, you're going to beat this, you're going to beat this, you're going to be fine," and you've got a medical team or oncologist saying, "You know, you're in this is tough, you're in tough shape, or this is dire," then you have sort of a mismatch of narratives, right? And so a narrative that is reasonable about your options, what's possible in your life with treatment, but even beyond treatment, sort of what you're hoping for, is to me is essential. And I worry about people who sometimes, you know, that people do have unrealistic expectations sometimes, and so. But Eric, you mentioned just being able to reach out to Reggie and get a little bit of reassurance, and both of you talked about a journey, and I think a journey is such an important concept, right? It's that language is important, that this is a journey, right? That day of diagnosis, Eric, sitting in a parking lot and that shock and that fear and the what about my family, that's kind of that's overwhelming. And you said it's a myriad, you know, it's not one emotion, it's this kind of flooding of sense of life. And there's a sense of death. And I talk to men about this all the time. Even if death is not conscious, the thought of death, anybody diagnosed with cancer, prostate cancer or otherwise, you have to confront mortality. You have to do it, whether it's conscious or not. That word cancer is a confrontation in some way with your mortality. You recognize the life trajectory that you hoped for, you know, may not be, and that's profound, whether or not it's a conscious thought or it's buried somewhere else.
Absolutely.
Yeah.
And so I guess, Eric, the way you kind of dealt with it was to kind of reach out to me. And initially, not, you know, I'm not a doctor, so I just gave you my opinion. But again, I think getting back, Max, to what you said, the one thing that Eric and I did talk about was that this was a journey. You know, this, you know, you can't, I know we think about kind of a whole lot of things that go through our mind, you know, our own mortality and the family and what am I going to do? How's this going to turn out? But I think at some point when you go through all of that, it is, it's nice to, you know, I think for Eric or to anybody to have someone to talk to. That's not necessarily your doctor. I mean, your doctor is going to tell you kind of what to expect and treatments and those kinds of things. But I think having a space even like this to really kind of talk through those emotions are so important. And I'm sure that you've kind of, Max, have kind of, dealt with that when you were working with patients going through prostate cancer, right?
Yeah, Reggie, and frankly, for men, I think some of the best indicators of wellness or kind of psychological wellness in my mind is friendships. If you have friendships, established friendships, that's intimacy right there. If you can talk to friends and reach out and make that phone call, not that that's an easy phone call, but the men who do well are the men who have relationships and friendships. It's the guys who are isolated or already alone who really suffer in kind of a in an upsetting way. They're really in that isolation because they don't have any to not have that support of a phone call or an old friend or someone who can be reassuring or talk them off the ledge. Eric, as you mentioned, that's it's easy to take friendship for granted.
True.
It really is, and just take a step back and realize when you have those deep friendships and you can make that call, that's to me is such an important ingredient in this concept of just psychological wellness with any illness, frankly.
Mm-hmm.
Yeah.
Well, I did, as we talk about relationships, I know one of the relationships that we have with our partners, and this prostate cancer thing and treatment can have some issue. We can have issues, and I noticed that there was one thing about there's a lack sometimes of a focus on a partner's experience, and Max, how do we increase conversations around sexual health to include the partners? I mean, my wife was there with me, all the time, and all of my appointments and things like that. But there was not really any engagement. I mean, I engaged her in what was going on, but it was almost seemed like partners sometimes can be sort of this not part of the equation, or not a integral part of the equation. Is that kind of a thing that happens?
Yeah, Reggie. I mean, I think in our medical world, we kind of treat the patient as this kind of singular unit, this individual. And I think some of the most interesting conversations that I've been a part of, either witnessed or been engaged in, are being in an office or being in a space with a oncologist who's having a very frank conversation, or eliciting from a partner, a wife, girlfriend, whomever, saying, how are you doing? What are you thinking about? What's going on for you? And those are not easy conversations, but that being inclusive of a partner, to me, if you have your wife in the room with you, they're part of the deal. There's a reason they're in the room with you. Now, whether or not you wanted them in the room with you in the first place or not, that's a different question, right? And some people have relationships where they want their spouse or partner there, and that's easy that's welcoming or reassuring. There's some guys that want to do it privately and say, honey, I want you to stay home. I'm going to go in. Everyone's different, but the fact of the matter is, the more these can be conversations, the more these can be conversations, the easier it is. And in some ways, asking a partner or spouse, what are you thinking about? What's going on for you? And again, this can come from a medical team, oncologist, nurse, whomever could, that to me is kind of the hallmark of good care. That kind of goes beyond just like medical care, but really intentional, thoughtful engagement with someone. And those are some of the most meaningful moments, frankly, is when family's included. And I've seen that done well, and I've seen it done, and I've seen it not done at all. I've seen the neglect around that as well. Yeah.
And I was going to say that I think people, health professionals mean well, but I was just thinking back to the many different appointments, and then having a biochemical reoccurrence this year, and going through proton therapy, and I don't remember that they asked about me. My wife asked a lot of questions, but there was never kind of engaging her in
Yeah.
necessarily, and sort of, how do you feel? I mean, she had to really bring it up and say, I'm going through stuff too, and how do I deal with it? So I think maybe there should be more of that engagement with, particularly, like you said, a lot of men don't want their significant others or spouses to come in. They just say, I'm going to handle this and I'll tell you what you need to know. And I think when you get a couple that are willing to, when you have your significant other, your spouse in the room with you, that changes a lot of things. And it takes a lot to say, oh, honey, come in with me, because they'll tell you want her to come with you, and you have to make that decision. And you say, yeah, come on. And then, but then in the room, was not really engaged in the conversation, which I thought was pretty interesting. So that kind of, when I saw that, I said, there needs to be more of that, hopefully.
Absolutely.
As we get through it. Now, for the sake of time, I have a lot of questions. I know Eric probably's got some questions too. But I did want to kind of jump ahead a little bit, because, we talk about relationships. Treatment is treatment. I mean, there's always, I won't say side effects, there risk or whatever from any treatment that you take. I remember my fraternity brother, Ralph, who really helped to start this whole If You're My Brother's project, said that anybody that says you're 100% is lying. It's never, and I don't know, it's never 100%. But when you get treatment, that, men have issues with incontinence and ED. I had to go through that with the ED situation still to this day, years later. And as men listen, and I don't want to, at first I was like, well, you do this, if you start talking about the things that might happen in treatment, then would drive men away from even thinking about it. And then I said, well, the first part of it is you want to live for your family, and that's important. So let's get over that hump first, knowing that if you are diagnosed, there's something you need to do eventually at some point. And so once you get through that, then we can address some of the other things that may or may not happen. I mean, it's not a guarantee. Like you said, everybody's different. But I wanted to ask you about this intimacy model that I heard you talk about, and what that means for couples navigating, life after treatment, if there's some issues.
Yeah, Reggie, I think the intimacy model, and there's different kind of models, these frameworks that people come up with, but the intimacy model really is that, sexual intimacy or relational intimacy is kind of a combination of, obviously, physical intimacy, but also emotional intimacy. And so the more that relational intimacy is encouraged, and often, by encouraged, that means open dialogue, honest dialogue about things that someone's feeling insecure about or worried about or anxious about. The more that those kinds of conversations are encouraged, the closer people feel, even if those themes and topics are difficult. And I think true intimacy, the intimacy I see between couples, is when there is honesty. Now, it doesn't mean everything is shared. We all filter what we're going to say or what we think about, but relational intimacy means there's an ability to turn towards your spouse, your partner, and be curious about their experience. And that goes both ways. It's not just what is the patient's experience. This goes back to what about a spouse or partner. They have to be, they're part of this. They're not the patient. It's not their body, but they're part of this experience. So all of the kind of evidence, and I don't want to get too kind of medically focused here, but all of the evidence is that couples that do well navigating prostate cancer are able to talk with one another to disclose what they're worried about. And one reason, Reggie, is, sometimes a guy will say, oh, I worry that my wife is, I don't know what she's thinking about. Or I've had guys who are divorced or they're dating someone new. I don't know if my girlfriend's going to leave me. They have all this anxiety about, their partner. Well, the fact of the matter is, they may not have had a conversation with her about what she's thinking or feeling. So they've created their own narrative about what their spouse or partner or girlfriend is thinking about. And until you inquire about that, you could be off base. So again, the intimacy model is really about having a dialogue about some of the kind of internal stuff that happens. And again, it doesn't mean that everything needs to be shared, but this sense that there can be some transparency, and that in the long run bodes well, and helps people also manage their expectations. So when you can talk openly and say, hey, look, or when a doctor can say, you're having surgery, and you're not going to be sexually functioning. You're not going to be able to have erections for quite some time. And have you talked about this? Have you thought about this? Just kind of modeling that stuff is important. Now, it's very possible someone has thought about that, or they've done their research, but sometimes people just don't know. They don't know what to expect. They don't know what's realistic. Right. So I think the openness around conversation is really important, and it's a lot to ask couples to do that right off the bat. I don't think that happens. So it has to be, it has to be encouraged. It has to be modeled. It has to be elicited in some way.
That's probably, and I know you mentioned something too about the sex script, or something that there may be a change in that, as far as what you're normally used to do, and now that things are different, you have to kind of, I guess, flip the script.
Absolutely, Reggie. Every sexual relationship, any long-term sexual relationship, there's a sex script. And what I mean by that is, there's someone who initiates, there's kind of a process that happens around intimacy, right? And so everybody falls into certain patterns with a partner or spouse. And those are not conscious patterns all the time, but they're developed over the years. Some people never talk about sex or intimacy with their partner. It just doesn't. It happens, or it doesn't happen, or when the mood strikes, it strikes. But the way things happen for each couple is going to be disrupted by prostate cancer. I mean, that's for sure. Your libido is going to drop if you're on androgen deprivation therapy. If you've had surgery, you're not going to be having erections, radiation. There's all these physiological and biological sort of consequences to treatment. The way people then engage around intimacy and sex is going to change. The script will change, right? So if you have no libido, you're not going to be initiating anything, right. And that can be a shock to a spouse who's maybe really used to you being physical and putting initiating, right? So again, these conversations and this kind of normalizing that, things are going to maybe different. And I've talked to men about you might not have any interest in sex per se, but your partner might just need a hug sometimes, and the hug has nothing to do with sex. The hug is she just needs a physical affection. And so to have these conversations and say, couples have to, work towards closeness, even if the sex script has changed. And I think that's what we try to encourage is it's not about sex per se. It's about alignment so that people aren't pulling away and isolating from each other.
And Eric, and I know you're single, right?
Yes.
So Eric has, if he goes through this and now he's single, you have a partner that you've been with, so you can have these conversations, but and I'm Eric, I don't know, how do you talk to, you meet somebody new and, things are different with you because of, going through treatment or whatever. And Eric, have you thought about that at all? Is that
I've been thinking about it quite a bit. Just to update you just a little bit. I'm just had my second biopsy. I'm out of, they're wanting me not to move away from active surveillance to actually looking and doing something. And I'm leaning towards doing a radiology. And I had a conversation with the radiologist on last Friday. And we went through all of the different options about, getting a prostatectomy versus the radioactive seeds versus the actual just straight radiology, and he went through all of the side effects. I've been categorized as cancer, kind of like he said, stage 2A, which means the bottom line, what we're going to do is we're going to do another MRI in March of 26. And at that time, just seeing where we are as far as the growth of it, because I got out of the 10 cores that they took out, they said they only saw it in 2. So they said you're in an early stage, but I need to actually look at doing something. So more than likely, I'm going to schedule it out to do the 28 days of radiation to deal with it. Now, between now and that time, I've been thinking a lot about just what you're discussing right now. As far as me with relationships, right now I'm not in a relationship. As a matter of fact, I just got out of one, and I'm just trying to wonder what the future looks like. As far as meeting new women, even while I'm going through, or even before, or either after. What kind of conversations do I have as it relates to what's going on with me physically? Do I keep this to myself? Because I don't know where I am in a relationship with a new woman. What do I do if I'm going through the treatment, meeting somebody, and then actually starting, and then what the future looks like after the treatment? But so I don't know. I'm thinking along your lines, Max, of at this particular age, at my age, I'm 68 years old, of just being upfront and forthcoming, just with it. This is where I am. This is what's going on with me. These are the things I'm able to do. These are the things I'm not able to do, and that way. And it's something that that you're willing to be with me as far as having to deal with some of the consequences. So those are the kind of things that's been going on in my head.
Max, what would you tell Eric?
Eric, thank you for just kind of being candid and transparent. I don't think there's a sort of right prescription for when you tell someone and how you tell someone. I really don't. People have asked me this. Do you meet someone new? Do you tell them right away? Do you wait? I don't have a good answer for that. I think there's every relationship. If you're meeting somebody, you're getting to know them. You're getting a sense of how open and honest can you be. We all sort of want to perform our best when we meet somebody new. We want to be the best version of ourselves, and we don't want to show the parts of ourselves that are more vulnerable or that are scary or that we're worried about the judgment from others. So, but ultimately, I think the disclosure at some point has to happen, because if you're holding on to it and you're just holding on to it, it just becomes it's like a secret that kind of festers, and then it psychologically it just takes up a lot of space if you feel like you're withholding something from someone you're getting close to. So I think disclosure is important at some point, and then you got to figure out sort of how much do I say.
Right.
And I think it's really hard. Look, I think it's hard. Certainly, if you're online dating, most guys are not going to put something on a public profile saying that they have prostate cancer. Maybe some would. I'm not saying you should or you shouldn't, but I do think it's a thing. Most guys who are, I think it's a real tough thing to navigate. Now, again, this goes back though to some of our fears, right? Guys worry about, well, is somebody going to pull away? Are they going to be disappointed? Are they going to reject me? They may or they may not. And I've had men say, well, what if I can't perform like I used to, or what if she's disappointed? And sometimes men have these conversations, and a woman may say, I'm not as interested in sex as you think I am, or that's okay. I just want to get to know you. I want to spend time. I want to go out to dinner, go for a walk. Let's go bowling. So again, I think sometimes men, we can get a little bit preoccupied with or fixated on maybe the sexual part of being a man. And frankly, that can be a very important part of our identity, but things change with age, things change with time. A 25-year-old and a 65 or 68 or 78 or 88-year-old man, people we change. Our realities change.
Right. Right.
So, I think we can have fears that sometimes are not founded. I mean, they're fears, but in reality, they may not matter to our partner or someone we just met. So, but Eric, I think that your sense that yes, you'd like to be candid and share some of this with someone when the time feels right. I think that's right on.
Okay.
I think when men try to live too contained, when they're really trying to filter everything, and this is like guys who avoid telling their children for a long, long time, ultimately I think it harms them and it harms relationships to be withholding for too long.
Yeah, that's a good point. I don't know, Reggie, if I told you this. I did tell you about my son, right?
Yeah. No, well, you told me that
he's going through a prostate scare. He's got a high PSA, but they have not found any cancer. His prostate keeps going up and down, and they can't isolate the actual cause as to why. But both of us, I've revealed what was going on with me to him, and now I've done it with the rest of my family. He's now gone through. We got together for his birthday about 2 or 3 weeks ago, and he laid the cards on the table as far as what was happening to him medically, and I did the same thing with my grandchildren. So everybody understands and knows now what's going on with the both of us. So I've actually been diagnosed. We still don't know where he is, and we all have he has to meet with his doctors in next month. They're going through a couple of things. Thought there was some noise in my house.
Sounds like a dog.
Yes, it is. It's my granddaughter's. I'm house sitting her dog.
I thought it was mine there for a minute because
no. She's gone out of town to do some stuff for her job. So she asked me to keep her dog. So
Yeah, no, I was going to say that, and we kind of segue right into the next question, and I guess Max, what Eric is doing is kind of right on to a degree. I know, at our age we have, sometimes it's easier and maybe not to talk to an older sibling or child that you have that you can, they're in their 20s or 30s, and you can kind of sit down and say, I have this, and they can understand what's going on. But now we talk about grandchildren. I mean, at our age, and we're talking about little ones, and there's this sense, well, at least in my mind, is to kind of shield, young children from like tough news. Just to kind of say, well, maybe they're too young to understand, if they're 7 or 8, and if I just don't say anything about grandpa, or if you have younger children and you're going through this, is that the way to go, even with younger children, or how should we handle that?
Reggie, it brings up a lot of memories for me of men that I've worked with who had very advanced cancer, who had young children, who waited very late to talk to their children, and really trying to protect them. And I think what that does in the long run is it isolates children in ways where they can't sort of feel closer to their parents, and especially in an extreme situation, if someone has a terminal illness and may die, and they're sort of avoiding those conversations. There's a real, for surviving children to not feel like they were included later in life, to say, my dad never said anything. I think it's very traumatic, frankly. And I use that extreme example because I think what we do is we overestimate. We think, if we disclose this, if we talk to our children or grandchildren, somehow it's going to create this fear, this anxiety, this worry, this harm. Well, in fact, and I say this being a father myself, kids at whatever developmental stage, they're selfish. They're in their own little world. So grandpa says he has cancer. There might be a little fear there, but we can educate. We can say it in a developmentally appropriate way. Right. We can disclose some of that so that they can have some awareness. And it doesn't mean it doesn't mean their world crashes down. You know, they're still in their 8-year-old minds and bodies, or 15-year-old, or 22. You know, they have their own stuff they're dealing with. So I sort of think, and I've had men say to me, I wish my kids cared more that I had cancer. You know, they'll talk about it with their children,
Right.
and
go on, right.
and well, and they'll say, how come my 22-year-old doesn't want to check in on me more? And I'll say, well, you know, at 22, you're kind of living your own life. You're figuring out how to be a young adult, and maybe you're not thinking about your dad's well-being so much. So anyway, so a long way of saying, you know, I think these conversations are important, and of course you don't share everything. You know, what you're going to share with your kids or grandkids is different than what you share with a friend. But I think it shifts relationships generally in positive ways, and I think there's a tenderness that can come out of that as well. But I think that can be hard. I think it can be. I'm not sitting here suggesting that it's easy. I think that sharing news like that is it's scary, because you don't know what the reaction is going to be.
Right.
Yeah. And children are resilient in their own way. But it sounds to me like, you know, figure out a way how to talk to them, whatever age that they are. That it's better for them to know than to wait, because what I'm
Absolutely,
hearing, Max,
Reggie.
is that that can
And
emotionally be with them for years, right?
And also, it's okay to disclose and not have all the answers, because what we do as men, and not just men, I mean, we think, oh, we need to wrap this up neatly. We got to have all the answers, right? And it's okay to let the child, or let children, if they have questions, the kids can ask questions when they're ready for those questions. We don't need to always sort of be, you know, we can let children lead, and sometimes they may not have any questions. They may, okay, you look pretty healthy to me. And that's another thing I would say is, you know, there's a disconnect for children, especially younger children. If there's disclosure around cancer, but you look physically healthy, they're not making that connection that you're sick or there's illness, because you don't look sick. Again, what I've seen happen before is guys go into treatment and they may lose weight, or they may start looking more frail. And that then is cueing to their children or family members that they're not doing so well, but that maybe they haven't had the conversation. So that's a different thing that happens. And so again, I believe, just from my work and from listening to stories, is that I've never had a guy say to me, I wish I didn't tell my kids. Never.
Well, I got to say this too. I think for me, it was a situation of sequencing and timing. Both my first biopsy and my son's first biopsy for his prostate were on this actually same day a year ago, May 21st, 2 days before his birthday. But we both at the same time determined that we weren't going to say anything until we knew definitively this was the direction, you know. So
you didn't know he was getting. You didn't know he was having it the same day.
Oh yeah, we knew because the thing was, I had my MRI, and that's when they had seen what they had seen because of my elevated PSA. So that's when I decided to went in for the biopsy. His PSA was twice mine, and that's what led him to go. They sent him to go in and do a biopsy. It's just so by coincidence, and he's in Memphis and I'm here in Atlanta. We both got our schedule on the actual same day at 2 different facilities.
Wow.
His was inconclusive. There was nothing, and that's when they did discover something in mine. But even with that, we were still looking at. We talked and we figured out the timing of when do we say anything, and I determined that it was better to go ahead and say mine because I knew definitively what had happened.
Did you have?
Yeah. His is still in the situation of we're still exploring and investigating. So at first, he didn't tell his children, and I didn't say anything. So we kind of came together as far as a meeting of minds. When we got together, when we were in Florida, that we would sit them down. And see, all my grandchildren are adults. So the youngest is 17. She's about to turn 18. So, I mean, it was It was a very frank. And it wasn't even an emotional uh, conversation. It was just, as a matter of fact, this is what we're going through. This is the stage I'm in, and it's just, and he explained his situation with where his PSA was going up and down, and what's going on with the therapy and stuff that he's going through to try to figure out what's going on with it. And they were very receptive, supportive, and just like you say, and it got a little bit emotional at the end, and they were glad that we came and we did that.
Mm-hmm.
So
wow,
as a family,
father and son, yeah,
oh yeah, and father and son, to his children and my grandchildren.
Yeah. Max, before we move on, we're about to wrap up. So is it good to have like a family meeting, or if you have, relatives or, children, or should I just say something to one and maybe the other one's going to get really emotional, and I don't know what
Reggie,
to...
I don't know. Again, I don't think there's a script for it. I think some families, sometimes people want to sit down, but when your kids are, again, if you're talking, they're not living in the household or in the area, they're living in a different state. How do you do that? Do you do that a Zoom call? Do you call them individually? Yeah. I don't think there's a right way. I think that, and different kids or different family members are going to have different reactions, right? Or they're at different points in their own life. So I don't know. I mean, I think family meetings, I think if everybody lives in the same household and you can do it, then, that's nice. It's kind of easy way of, not easy, but it's
getting it all out at one time. Yeah.
Exactly. I think it is hard sometimes, a phone call, Zoom to, you're not,
time.
You don't have, I think it can feel a little trickier, I think, just because you're in different spaces.
Right. Yeah. So as we look at this, Max, in your, doing what you do, are there like a top 3 psychological, emotional to-dos once you're diagnosed? Is there a process that we need to kind of go through? Like, we hear it, and I tell people all the time, if somebody asks me, what was it like when you were told you had cancer? And I was like, it's like the Peanuts cartoon, and the parents just go, whoa, 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 whoa. That's all I heard after cancer. I didn't, my wife heard most of it. I just kind of was just sitting there and tuned everything else out. But so we have a diagnosis. Is there like I don't want to say a game plan, but what should we do once we hear that?
Yeah. Well, I mean, on some level, I think for any man with prostate cancer, from a kind of gameplay perspective, you want to make sure you're comfortable with your care team. And I've talked to a lot of guys who they either feel like they were neglected, or they were maybe their experience was they were dismissed, or their primary care didn't do a follow-up test, or didn't want to test for PSA early enough, whatever it may be. So I think for most men, you want to feel like your care team, your oncologist, whoever's treating you, that feels like the priority usually is guys wanting a little bit more. They want to game plan medically. They want to know, hey, what's coming up. But I think in terms of kind of wellness or sense of self, I think it's a process. I mean, I do think it's a journey, Reggie. I really do. Some guys go very internal. They decide, they kind of retreat within themselves a little bit. And I think that's natural, frankly. Most people don't pick up the phone right away and call everyone and say, I just got diagnosed with cancer, because it's a shock. And we deal with shock sometimes by withdrawing or retreating. I think that's okay. I mean, I think that's kind of human. But then the question is, where do I go with this? Right. And I think having a place to talk about the things that are happening up here, and being able to be transparent about that really does help. It could be a therapist. It may not be a therapist. It might be a good friend. It might be a support group. There's some guys also that don't want to go to a support group. They say, no, I don't want to be surrounded by a bunch of guys talking about prostate cancer. I need a little break from that. And I do think there's this fine line between if you go down a rabbit hole of Googling and research and reading everything, you can get consumed. I mean, you can get consumed, and then the anxiety becomes pervasive and kind of overwhelming. So there's a balancing act between getting enough information to make treatment decisions, and then also saying, well, how the hell am I going to live my life? And what's important to me in my life right now? Because I think most guys are confronting that with a diagnosis. You sort of say, and some people say, well, I realize I've been miserable at work, or I need to retire, or I need to kind of address other things in my life. So I think there's a recalibration of what's important with a diagnosis. But I think I do think I think connection to other people is important. And this is going to sound pretty boring, but I think, I hate to use the word exercise, but I think just getting out of the house, and you're going to have days when you're down or you're overwhelmed, but taking a walk, getting out in the world, I think these things really matter more than we realize. Just kind of, just getting out there, and living life.
And I think just listening to you, you said we tend to want to know information medically. I know when I was diagnosed, my PSA, after having it removed and being cancer free for 12 years, and then my PSA was 0.14, and it had always been 0.00 something, and I'm like, okay. So I talked to my oncologist, well, we'll just watch it, and it kept creeping up a little bit. And so when it got to 0.24 or 0.25, I looked, and it says, oh, when I Googled it, and the chat GPT did or whatever, it said, oh, well, that means at that level you have normally a biochemical reoccurrence. And then in my mind, I was like, what the heck is that? So I'm trying to, I'm looking at that. I'm trying to figure out, what is this biochemical reoccurrence now that I'm at 0.25. And interestingly enough, we as men, we tend not to want to, Eric did it, but to reach out. I mean, we don't look at, okay, what are the options for me just to talk to somebody else? I mean, we've got a medical team, but is there a Facebook group, or is that somebody that I can talk to? And I will say that the facility, the Proton Therapy Center did, interestingly, I said, well, is there somebody I can talk to that's been through this? And they were like, yeah, yes, we've got these ambassadors, and we can. And so I reached out to a person that really, I knew the person, which was funny because, they just gave me his first name and last initial. And I was like, is this so-and-so? He's like, yeah. I was like, oh, but he really helped just kind of walk me through things, what to expect. And that kind of, to be honest with you, that did more for me than all of the going down that medical rabbit hole about, oh, this is what, I mean, I don't know how many videos I watched about treatment. And one doc even said, yeah, well, it was 2.5 and we did this PSMA on him, and it was lighting up on here and it's lighting up there. And I got he just went in and we got radiation. We then killed that sucker. And I'm like, wait a minute. What? He was like a marauder or something. We only got and it scared the hell out of me. Oh my goodness.
Yeah.
And then the thing was, is it like where is it? Because I don't have a prostate anymore. But anyway, I just went down that rabbit hole. It was I did not tell my my wife. I did the PSA MA, the scan. I just told her I had a routine. I didn't tell her actually until I knew that they couldn't find anything, but it was still there. So once, I kind of figured out, kind of like with Eric, I guess I got to a point where, okay, it's not there. The scan came back clean, but the PSA is still going up. So I know something's going to have to happen. And then that's when I started engaging. But I needed something else. And I think we tend to forget that what we're doing here and listening to what some of the men that are going through this, like Eric and myself and others, Facebook groups. There's, and maybe it's therapy. Maybe it's somebody like you, Max, that we can talk to, because I don't think we deal with that part very well as men. And my question as we wrap up, and I got a couple of more asking about what you're doing now, and I really want to know about the real therapy, the fly fishing thing. That's pretty cool. But I do want to ask, as spouses, partners, family members, how can they best support the loved ones that are emotionally going through this beyond just the logistics of it all?
Yeah, I mean, that's a big question, Reggie. I think that, for a lot of men, we just want to be heard. We want to be able to be on what's going on for us. And I think sometimes what happens with family members is they want to resolve something, or they want to solve something for us, or they have advice. And I think, particularly, sometimes spouses want to they want to solve something. And I think there's times just for listening. And I think that allowing them to be vulnerable with fears, with anxiety, with worry, that's important. Just to be able to listen, and because think about how you feel in a conversation with the two of you guys talking offline, or any personal conversation with a friend, where you just feel like they kind of got you, and they're holding on to your story or whatever you're carrying with you. And I think that ability to just sort of be present, and not try to resolve something, and also not try to sort of do everything's going to be fine, you're going to be fine, because I think sometimes the reassurance can backfire a little bit, and I see that, or I see spouses say, oh, you're going to beat this, and I think sometimes that it doesn't work to settle you. And so I think being able to speak for yourself and have people who can just kind of listen and acknowledge it. But again, that can be easier said than done. And I think oftentimes family and friends, they have platitudes, right? You're going to beat this, you got this. And that can feel nice. I'm not dismissing that, but sometimes that doesn't align with your experience, because Eric, as you talked about, if you're waiting on a next step, you're waiting on an MRI or PSMA or whatever it is, this is a process. This is a journey. It's even if you're in surveillance, there's that awareness that, this can creep back up again. And you're playing a long game. So,
and it's funny to your point, because before I met with the radiologist, he had me to go have PSA done. And I could not sleep waiting for the results to come. And when the results came in my email, I didn't look at them until the morning that I was getting ready to talk to him. And I cleaned my house. I went and worked out. I did everything right up until the last minute that I actually had to go look at it. And then I took an actual real deep breath, because I'm thinking, what if this thing is shot sky high or whatever? I don't know what I'm looking at. Luckily, it went down a point.
But is it better, Max, for him to just? Well, I guess we all deal with it differently, right? And I would do the same thing. Is it better just to get it out of the way, or just?
Yeah, I was thinking of that too. See, but the thing I was in the middle of working. And I'm saying, okay,
you don't want to have to.
If I do this, then I don't sleep, then I can't work tomorrow. Because that's all I'm gonna be.
Yeah, you don't want to be consumed if you. Yeah, I don't know. I mean, I think again, everybody kind of handles that information, like when you want to see a lab report or your PS. I mean, I think everyone's different. I don't think there's a right or wrong way. But I think what happens with prostate cancer in particular is we focus so much on PSA, we focus so much on Gleason score, and I think it's a bit of a disservice because it doesn't paint the whole picture, right? A rising PSA may or may not be a concern. It may be very normal. So sometimes if we focus too much on a marker that doesn't tell a whole story, then we get ourselves all worked up about something that in the grand scheme of the course of treatment or life, it doesn't matter at all. You look back and say, oh yeah, it didn't matter. That was just a little blip. So I do think, I actually think it's good to sort of recognize that something like a PSA is, you do need your team or your doctor to put it in context and interpret it, because if you're just Googling it, you don't know what it means
Right.
In your particular case, right? You can see a PSA that's jumped. Well, has it doubled? Has it tripled? Where are you with treatment? It may or may not be a concern. So the context matters. And so I think being able to trust your team or trust your oncologist that they understand it in a context that you may not, that's what's helpful.
Mm-hmm. So as we wrap up, what are you doing now, Max? I saw this psychedelic thing. I mean, you don't have to go really into detail, because I know it's probably a lot, but just in general, kind of.
Oh, that's fine, Reggie. Yeah.
Well, I
Well,
was just curious.
so essentially, I work now on psychedelic research trials. So these are LSD, mushroom, psilocybin, DMT, which is in ayahuasca. So these are all kind of synthetic compounds that the drug companies are making, and they're testing for. Ideally, they want FDA approval. And what's interesting, actually, is some of the earliest studies were for cancer patients, and particularly for patients who are facing end of life and going into hospice, who have real distress and angst about death. They had really promising results with psychedelic therapy, where people could take a dose of mushrooms and have experiences where they could really work through some of that fear, and they could have kind of let some of their walls down. And so these psychedelic compounds and medicines are used to kind of help expand people's consciousness. And I know there's a lot of history to it, and people think about the 60s and 70s,
right.
and there's a lot there that's a whole other conversation. But yeah, what I do is I work with people in clinical trials who are, some of them very depressed, some of them are very anxious, to see if these psychedelics will help. And oftentimes they do. And instead of having to take a medication every day, like a SSRI, antidepressant, the idea, I think in 5 to 10 years, people may take a small dose of mushrooms, maybe 6 months or once a year, and it's kind of a reset, and it's pretty profound. There's actually a documentary on Netflix right now about, I was watching it last night, about Iraq, Gulf War veterans, or Iraq War guys with severe PTSD and traumatic brain injury. And these guys not functioning at all, drinking a lot, all sorts of drug use, violent outbursts. And this particular movie is about ibogaine, which is a West African plant. And you can do it in Mexico. It's illegal in the States, but these guys have, it gives them, it's a reset, and it allows them to sort of see their own lives in a different way. And it's pretty profound just to witness some of these stories. So anyway, so that's kind of what it's much more involved than that, but
yeah,
I'm sitting with people on these trips.
Wow.
Yeah,
wow.
yeah.
Interesting.
Yeah.
We'll have to keep an eye on that one if we
Yeah.
can. Right?
Just think, 50 years hence, we're back talking about drugs again.
Exactly.
We could do that in the dorm room.
Yep.
And medical marijuana. So we've come to full circle.
Yep.
We've come the whole full 360.
Oh, Max, thank you so much. And Eric for joining us. Before we go, got to talk about Real Recovery. I know that's an organization that's close to your heart. And man, I tell you, I saw the TV story, the news story, and I was close to, and I could see that the anchors were kind of tearing up as well. It's very, very touching. You want to tell us a little bit about that?
Yeah, Reggie. Real Recovery is a nonprofit that takes men from all over the country on fly fishing trips. So men with cancer, any kind of cancer, not just prostate cancer. Guys can be in surveillance. They can be active treatment. They could be cancer-free for 10 years. They could be newly diagnosed. all ages, all backgrounds, and they're typically like 3-day retreats, 2-night overnights, fully paid for. So lodge, food, and across the country. So I don't know how many states, maybe 30, 32, 38 states. We have retreats, and it's fly fishing. And a lot of the guys that go on these retreats are, they're marginally interested in fishing. It's not really about the fishing. It's about that brotherhood of being with other men. And so what happens is they sort of learn to fish during the day, and often in very beautiful, kind of pristine locations. But in the morning and at night, we have what we call courageous conversations. And the courageous conversations are, men circle up, and we pose a prompt or a question, and it's a reflection, and guys get to share. And it's, we're not looking for right answers. We're not proselytizing. We're not trying to impart some particular outcome or wisdom. We're just creating a space for men to talk about their experience. And what happens in those circles and those conversations for these men it's deeply impactful. It really is. So I encourage any listeners, just go to realrecovery.org. If there's a retreat in your state, you can sign up. They're always, it's pretty easy to get on a retreat, frankly. And these can be really meaningful little journeys for guys who just need a space to both to unwind from kind of their daily life, but also maybe voice things that they've never been able to talk about. So it's a pretty cool organization. Yeah.
So we'll put the link in the show notes, as well as the news story too, because that was very, very touching to see that. But Max, thank you. We're gonna have you come back on, and maybe we can talk a little bit about the mushrooms and some other things.
Absolutely, I'm happy to, Reggie. Yeah,
I think Eric is excited about that part, right? No, but thank you so much for the work that you do. I'm sure that we're going to have other questions and things to come up, so we may have to get you back on just to do a Q&A with some of the guys. And Eric, as always, I feel like you're my Guillermo to my being Jimmy Kimmel.
So, there you go.
So you can just gotta be my sidekick on the podcast.
Hey man, the pleasure's mine. Like I said, as we go through this journey.
Yes, and thank you for being transparent, because that's
you know what, in doing this, not only if it's helping somebody else, that's great, but this really helps me. And Max, I really appreciate you being on.
Thank you. Yeah, thank you, Eric, and thank you, Reggie. And really a privilege just to for you to really be creating a space. And I think just for any guys listening to know that these kind of conversations can happen, and if it is just a little bit of a seed that you're planting, to encourage that they talk to a friend, a spouse, anybody, reach out to you. I think it's wonderful work. So yeah, thank you for the opportunity.
All right, guys. Well, you all take care. Thank you so much for
being
with us.
Have a great evening, everybody.
All right. And thanks to everyone for sending in comments and questions. I hope we were able to give you some insight and help some folks with similar questions tonight. As I mentioned at the beginning of the show, we are taking this journey together. So if this episode resonates with you, please share it with a loved one, like and subscribe. That's how we kind of build this community, this If You Are My Brothers community. You can also connect with us via email, social media, and even regular old snail mail, as my wife likes to call it. You can listen to past episodes as well. All of the information you need is at our website, ifyouaremybrothers.org, ifyouaremybrothers.org. You can also sign up for our e-newsletter. Comes out every other month. So we've got one coming out at the beginning of December. Now, we want to remind you that If You Are My Brothers is a nonprofit 501c3 project dedicated to prostate cancer awareness and health action, and that we hope you will support us in what we do. Here's a slide with options for giving. If you are listening to our podcast, the link is in our show notes. And when you make a contribution, you'll receive your very own If You Are My Brothers commemorative mug. And we want to thank the folks over at Atlanta Brand Central for providing our mugs for us. And they're really, really nice. And you'll also be placed for everybody that reaches out to us. We'll be placed you in the hopper for a chance to win an original painting of our Everyman logo, we call it. And it's a rendition that was done by a renowned artist, Cecil Bernard. You can kind of see it there behind me, but it's huge, and it's an original, and he is renowned. So, oh, sorry, that's a good thing. But we're going to make that drawing in December for everyone that makes a contribution or just reaches out. So you don't have to make a contribution to be entered to win. And here is the mug. There, you see it. It's a brand new. The one we had before was black and white, but this one is in color. And so we want to send that out to you just to thank you for supporting us in what we do. The audio version, as I mentioned, of this episode will be available next Wednesday on Apple, Spotify, all the major platforms, wherever you get your favorite podcast. We want to remind you, please, to subscribe so you'll know when new episodes come out. All of our episodes also are archived on our YouTube channel as well. I want to say special thanks to our producer, Danny Garcia Pozo, and of course, Zach Reynolds at Borkhouse Productions for our opening. Thank you very much, Zach and Danny. Remember, this podcast is not a replacement for medical advice. Just to let you know, always confer with your healthcare provider about your health. Now, join us on our next episode. That's going to be on Thursday, November 20th, a week before Thanksgiving at 7 p.m. Eastern. And now it's standard time. So, no more daylight savings time, for at least for a while. We're going to be talking about protecting the prostate, the myths, the truths, and what every man needs to know. It's a holistic discussion focused on maintaining good prostate health and prostate wellness, as well as overall general men's health. We'll talk about too. So want to join in for that. We've got some really great guests that'll be joining us just to talk about, what to eat, how to exercise, things you need to do just to stay on top of this thing. Now, If You Are My Brothers is a project of Straight Street Media, and you can learn more about Straight Street Media at straightstreetmedia.org. And that's about it, folks. I want to thank again Max McMahon and, of course, Eric Cheney for coming on and providing information for us today. The psychology of prostate cancer is so important, of just the things that we go through in our mind as we try to deal with the physical part of dealing with prostate cancer. So thank you for being a part of that and being a part of the conversation. And until next time, if you are my brothers, you will share this message. Take care, stay healthy. Peace.